On your day of surgery, you will arrive to the hospital at the time given by your surgeon's office. You will check in with the guest services staff on the first floor and let them know you are here for surgery. If you have any additional paperwork or other things to complete, you will be asked to do so at this time. You will then be sent to the second floor same-day surgery waiting area desk where you and your care partner will check in for surgery. Next, you will be called to go to the pre-op room. Your care partner will remain out front until you've had a chance to change into your hospital gown and remove all items from your body, including contacts and body piercings. You will also have any necessary pre-surgery tasks completed. These might include checking vital signs, taking a pregnancy test, getting a blood sample, a nasal swab, checking your blood sugar, starting an IV, and receiving antibiotics and other pre-surgery medications if indicated. Please be sure to wipe yourself down with the surgical wipes to help prevent infection. Your nurse will ask you questions about your medical history and your upcoming surgery. You may complete the consent for surgery paperwork at this time if you haven't already. After the nurse has completed this process, your care partner will be able to wait with you until it's time for your surgery. When it's getting close to time for surgery, your anesthesiologist will come speak with you. He or she will provide information on the type of anesthesia you will receive, along with information about a nerve block if it's recommended for your surgery. A nerve block numbs some of the nerves that supply the area of your body where you are having surgery. If a nerve block is recommended, you will be moved to a different room where you will receive medication to help you relax before the nerve block. If you are getting a total knee replacement, a small tube or nerve catheter will be inserted near the nerves that go to the knee. This small tube will automatically give you numbing medicine for a few days after surgery. For hip replacement surgery, a single injection of numbing medicine is used and should give you some pain relief for most of the day. The nerve block will help reduce pain after your joint replacement and will improve your ability to work with the physical therapy team. After the nerve block is done, you will head into the operating room. If you are having a total knee or total hip replacement, your surgeon prefers a spinal anesthetic because it helps patients have a faster recovery after surgery. This is the same type of anesthesia that pregnant women get for C-sections. After the numbing medication is injected, you will receive medication through your IV to put you into a twilight sleep during surgery. If you are taking any blood-thinning medication, it is important to tell your anesthesiologist. This is the recovery room where you will wake up after surgery. You will be connected to monitors so that the nurses can watch your vital signs closely. You will stay here until you are awake, until your pain is tolerable or back to normal level, and until your nausea is controlled. Your care partner will be updated on the progress of your recovery. Your time spent in the recovery room will vary based on your individual needs. From here, you will be transferred to your hospital room on the floor. Once you arrive at your hospital room on the floor, you will be introduced to many different staff members. These will include your medical team of physicians and residents, as well as your bedside nurse, who will give you information about your medications, pain control options, and hospital policies. Your patient care technician, or PCT, will help you get to the restroom, assist with daily baths, and order your meals. Your discharge planning begins the day you arrive. You will have a care management team that includes a nurse case manager and a social worker who will help you with your discharge planning needs. The case manager and social worker will ask you important questions about your goals for discharge, insurance, who your available caregivers are if you need assistance at home, and your plans after surgery and follow-up care. It's important to talk to your case management team about your goals for discharge so they can better help you get the assistance you need. Occupational therapists and physical therapists will begin visiting you on the same day as your surgery to help you get back on your feet and doing the things you love more quickly. The therapist will work with you to prepare for discharge and make any recommendations for medical equipment you might need at home. This team of professionals will work together to help ensure that you can be discharged safely. Your case will be discussed by your team of providers every day during transition of care rounds. The team will discuss your estimated date of discharge, and your care management team will talk to you about your options. Once your medical team feels you are ready to discharge from the hospital, the recommendations from your therapists and caseworkers will be combined into a plan to discharge you, either to rehab or home. you might be discharged to home independently or with a home health service if you need a bit more help. Your medical team wants what is best for you, and we are here to help. We will see you soon.